These are very simple to use wipes. What you want to do is you want to identify those areas of intact skin or surface or items that may have chemical contamination on them. You then tear open the packet. There's a little notch on it, as you can kind of see here in the corner. You'll unfold the FAST-ACT Decontamination Wipe, and then you actually want to kind of crumple it up. You don't want it to be neatly folded or anything, and that's really a way to expose the FAST-ACT decontamination material. And then you'll put it to that surface, skin, surface, whatever it happens to be, to decontaminate, adsorb, potentially neutralize whatever that contamination happens to be. And really the best process is a bit of a combination of blotting and wiping. Make sure the FAST-ACT Decontamination Wipe is used around fingers, joints, and other areas that may harbor chemical contamination. Upon completion of the process, the wipes can be disposed of according to proper procedure and protocols. After completion of the decontamination process, place all of the items utilized for the chemical containment and removal into the proper disposal pathway. Follow hospital procedures, protocols, and hygiene plans.